Good afternoon, everybody. Welcome to the St. Clair County Weekly Report on Facebook Live. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management in the county. And with us today is Dr. Annette Mercatante, the St. Clair County Medical Health Officer.
Welcome. Thanks for Facebook Live. Justin, go ahead and take the data.
Yep. All right. So we're going to brief you on the data now. Totals to date, we have 6,605 total cases, 351 total hospitalized, 136 deaths, and 3,195 recovered. In the last 7 days, we have 474 new cases with 67.7 average new cases per day, 584 tests per day, and that puts us at a 10.8% positive on those tests. This is a really telling graphic. As you can see, we peaked and now we're on the backside of the peak, and we continue to fall. So we continue to keep a close eye on the data, but that is a good sign. This is our percent positive for testing data, and it kind of falls right in line there, right around the 10% mark. And as always, you can stay up to date on all of the data for the COVID-19 response at stclaircounty.org/offices/health/COVID19.aspx. All right, so we have a bit.
Just want to make a note about that second graph as we come down the other side. If you notice where we're at on that graph, we're still way above the levels we were in March. So although the good news is we're coming down, the bad news is we still have a lot of disease transmission, a lot of viral transmission, and where this ends or lands, we'll probably have a much better telling of how the next few months are going to go. If we plateau here where we're at, we're going to continue to have a lot of activity, a lot of people out ill from work, and of course the hospitalizations and deaths that follow. So good news, but we need to keep up the work.
Yeah, we're keeping a close eye, like I said, on things. We are by no means out of the woods. The woods are still very tall, and there's a lot of wood to be cut. So, all right, I want to talk a little bit before we get going on how it's going to go today. It's going to be a little different. So until 4 o'clock, we're going to answer your questions, and then at 4 o'clock, we're going to transition into a COVID-19 vaccine brief. And then once we get through that brief, we'll transition back to finish up answering your questions. Right, Jen? Didn't miss anything, did I?
That's correct. Do you want to announce our special guest today?
Absolutely. So, and with us, you'll hear another voice, a new voice today. Barb Tadero, a nurse at the health department. She is the nursing coordinator for immunizations, and she is the captain of the immunization ship for us. She's a very busy lady now, and we are all following her through this, through the new portion of this response. So thanks for being here, Barb.
Thanks for having me.
Hi, Barb. Welcome. Okay, let's get started. We have a lot of questions that came through last night, and we can get started on that. So first, Doc, do you want to talk about our vaccine that came in yesterday?
Sure. So we did receive our very first shipment of vaccine. We were provided the Moderna vaccine. Approximately 900 doses came in. We'll be vaccinating actively over the next several weeks until we have the ability to get more. The state will require us to request more vaccine, and we anticipate being able to continue to get vaccine as the weeks and months unfold. So we're going to start out with our priority groups. As we talked before, we can talk more about priority groups. And you want to talk about that now, Jen? Maybe
Sure.
We should.
Let's do that.
So because vaccine will ultimately be available to everyone, but as people know that the process of getting this vaccine out is going to be slow at beginning, the priority areas have been established both through the federal government, the CDC, and independent vaccine groups. And so we are obligated both morally and everything else to follow these priority groups. That means that the first allocations will go specifically to our healthcare workers and those people who are on the front line of seeing COVID patients. So people are transporting COVID patients, people are going into COVID homes, basically healthcare providers and both paid and unpaid who are involved with providing services to people who are ill. And so our hospitals are taking care of their hospital staff. We're teaming up and helping with all of our transport systems, our EMS. We will be looking at our ambulatory care facilities, our doctor's offices, their staff, and the list is available. So if you're wondering if you are in the 1A category, the first grouping of people who are going to be receiving vaccine, we've developed a simple survey that you can take that asks, does your job require you to do this? Okay. Basically in-person direct interaction with people with COVID. Then you can answer these questions, and if you answer yes to any of the questions, you will know that you're in the 1A priority group. So that will hopefully answer your question. We can't possibly name every single job description, but if you can answer these questions, honestly, you'll be able to identify yourself as a 1A group. Based on that, you will be told basically through the various sectors that you work in when these clinics are going to be available to you. And we'll be providing that information, a link to make your appointment. And so this is not going to be something that's going to be put out for the general population. It's going to be put out to you and your agencies that that basically provide these services. So that's our approach. If you feel like somehow you've been overlooked or you feel like you need to be included in this notification, use our COVID-19 at stclaircounty.org email. Put your information in there. We'll include you in our emailing system. But other than that, we're not creating a list. Okay, so you don't have to send us your individual name and information. If you work for an agency that provides services to COVID patients, and we pretty much have all of them accounted for, you should be able to be notified through your agency that your opportunity to vaccinate. If you work independently, for instance, and you're self-employed, those would be the kind of situations you would want to notify us through the COVID-19 email. So hopefully that'll answer some of your questions. This process is likely going to continue for several weeks. And then once we're satisfied that we've gotten through that 1I priority area, we'll move into the 1Bs and the 1Cs. And we'll get into that later.
Okay, thank you very much. Okay, first question. Will people with a low immune system due to past chemotherapy be able to take either COVID vaccine, Moderna or Pfizer?
So immune compromised conditions have not specifically been studied in the Pfizer or the Moderna products, but we have been advised that they can be offered, the vaccine can be offered to individuals, that the safety profile is no different. And the real issue is that they have not specifically studied in, for instance, a post-chemotherapy person or in a post, autoimmune condition. So all those various conditions have not specifically looked at. So the effectiveness of the vaccine is a little less certain. The safety profile is going to be about the same. And we can advise you that if you choose to get vaccinated, you can. It will not be a contraindication.
Okay. Now, I know you already went over phase 1A, but here's some specific questions. And Justin, we'll start with you. When does police, fire, and EMS get the vaccine? So
EMS is in group 1A, and potentially there may be a small group of fire if they have paramedics and EMTs that are embedded with them. They may also fall in 1A, and the rest of fire and police will fall in group 1B.
And then somebody also wanted to know, and they've asked several times, their husband is an industrial plumber. Where would they fall?
So potentially they could fall into the essential services and that would be 1C. But it would be up to their employer to ensure that they make contact with the appropriate health department, whether it's ours or another county, to ensure that they're on the list of essential services.
I think you meant 1B, right, Justin?
Yeah, maybe it's 1B. I'm sorry.
Yeah.
Okay.
Okay.
I don't have them in front of me right now.
1B, essential
Yeah,
services.
1B. 1B.
Okay, Barb Tadero, maybe you could answer this question. Can you explain who should not receive the vaccine? Are there any specific medical issues or allergies that are contraindicated with this vaccine?
Sure. So we should not administer the COVID-19 vaccine to individuals with a known history of a severe allergic reaction, anaphylaxis, to any component of the vaccine. So all of the contraindications are listed in the emergency use authorization fact sheet that is available to people that they can check out on our website.
Okay, thank you. Can the second vaccine be given in the same arm? Or if somebody has a medical condition, can it be in different arms? Do we know that?
So this injection is intramuscular, and it needs to be given in the deltoid muscle or the muscle in the upper arm. And both doses can be administered in the same arm, or if someone chooses to get them in, different separate arms, that's fine also.
Okay, thank you. How soon after having COVID is it safe to get the vaccine?
I'm not sure if Barb wants to do these or me.
So as long as someone is out of their time frame of isolation and they are recovering from their symptoms, so they would need to be, past their 10 days of isolation, at least 24 hours without a fever and improvement of their symptoms, then they would be able to get their COVID vaccine. Unless Doc has anything more she'd like to add.
Well, one of the things that comes up is that we know that reinfection in the first 90 days after an acute infection is rare. It's not unheard of, but it's considered very uncommon, which means that a person who has recently recovered within the last 90 days of a COVID infection may choose to delay. And that's how they've labeled it. They may choose to delay if they want to. They do not have to. And it's very unclear whether immunity lasts, how long it lasts. And so I think you have to weigh your risk of COVID infection, potentially even getting an asymptomatic infection and shedding it and sharing it with your home or with your colleagues compared to the fact that there really is no change in side effects or efficacy based on whether a person has had a previous COVID infection or not. They did do that in the studies. They did check people's pre-existing antibody titers and history of COVID, and there was no difference. So the decision to delay for 90 days is really a personal decision based on your overall risk and how confident you feel that your natural immunity may be supporting you, which you obviously don't know for sure.
Thank you. Barb, maybe you can answer this one. What determines which vaccine you should receive? Can I request to have the Pfizer vaccine?
So at this time, like for instance, the health department is currently going to be administering the Moderna vaccine. So depending on when you are able to receive the vaccine and what location is available at, you may not have a choice as to what vaccine is available. Now, moving forward, when more vaccine is available at more provider locations, someone may have the opportunity to be more selective. However, if you are looking to protect yourself from COVID-19 and you're, in the priority group that you are able to receive the vaccination, it would be beneficial to receive the vaccine when it's available to you so you can get protection.
Okay, thank you. Now,
and if you start with one vaccine product, you need to finish with one vaccine product. So that's important for people to remember. So if you start with Moderna, you should finish with Moderna, or vice versa.
All right. Once we are vaccinated, why do we still need to take precautions like wearing a mask and social distancing? That's been a big question.
Well, okay. I start, and Justin, you pick, and we've been answering this question a lot, I noticed on Facebook. But there's a couple really obvious reasons, and that is it's going to take a while to get people.
Oh,
Oh, there we go. Am I back? Okay.
yeah.
It's going to be a while before we can vaccinate our community and our population to a level where transmission is not rampant. And so during this time, other ways of reducing your risk for infection are going to remain very, very important. The other issue is to remember that not everyone is eligible for a vaccine. For instance, this is a vaccine only for 16 or 18 years old and older, and we know that this virus transmits very easily in younger populations. So there's going to be a fairly substantial amount of people who aren't going to get vaccinated, even with our best efforts. So I would say for the near future and for the kind of foreseeable future, get used to wearing your mask, people. Get used to staying distant from other people, large crowds. Those kinds of things are going to continue to be a hot spot and a problem area.
Yeah, and I'll add that right now we know that the tested efficacy during the initial trials was 90 to 94%. So that still leaves, between 6 and 10% of people that may not be protected from the vaccine or more, just depending on how it all rolls out. So there early on, there is an opportunity that the vaccine may keep you from getting sick, but it may not stop you from continuing to transmit the disease. And we're just plain gonna miss some people, even though they're vaccinated. So just understand that we're playing a numbers game right now, and we're asking everybody to just stay the course for a little while longer till we can get that numbers game up higher and get it done for everybody, or as many people as we can get to take it.
And that's a really good point Justin brought up. The vaccine trials, the phase 3 trials, very specifically because we were very focused on getting this vaccine and knowing what it did, very specifically focused the outcomes on whether a person got a symptomatic infection of COVID or had a severe infection with COVID that required hospitalization. And in both of those areas, the vaccine was very effective. The trials did not measure whether or not there was asymptomatic infection or further transmission of the virus. Now, we would hope that if a vaccine prevents serious symptomatic infection, it's going to also reduce transmission in a less symptomatic way, but we don't have that information yet, and we can't say that this vaccine is going to reduce asymptomatic transmission, which we know is a huge problem, right? So we have to keep our guard up.
Okay, thank you. Will the people who receive the vaccine yet still get the virus be a lighter case as it is with influenza?
Well, that goes back to what I just said. We do believe that the vaccine will reduce symptomatic infection. Does that mean if you get the vaccine, you'll have less serious? I think that still remains to be seen, but the data clearly shows that people who were vaccinated did not get symptomatic infections. So to me, that would mean less serious infections as well. Yes, and definitely less serious infections from the studies as well.
Okay.
So yes.
Thank you. Is it okay for someone with MS to get the vaccine?
So MS is considered an immune-related disease, autoimmune disease, amongst maybe some other things. And so, yes, a person with MS could receive the vaccine.
Okay. Barb, maybe you can take this one. Is this a vaccine we will need every year?
So I don't think we can honestly say that we know the answer to this question yet. So as we continue moving forward with vaccine studies and studying this virus, I think that answer will come in the future.
Okay, thank you.
And like Barb said, I think that will be a large part of our learning curve as we continue through this process. We're gonna continue to gather data on a local level, on a state level, and on a national level, and learn everything we can from this.
Dr. Mercatante, you might be able to answer this, and/or with Barb, or just you. Someone had asked last night about legal consequences if someone ends up becoming sterile down the road. Are there any plans in place if this vaccine ends up causing damage, so to speak?
So all the vaccines that I understand are all going to be part of the National Vaccine Injury Compensation Program, which does allow for compensation of presumed vaccine-related injury. And there are criteria for that program, and it's funded as well. So yes, the simple answer to that question is yes. Injuries or potential issues related to the vaccine would be covered under that compensation program.
Okay, thank you. Do we have any idea of how many people there are in the 1A, 1B, and 1C groups?
Yeah, about, what do we think, 4,000, 5,000?
Well, we know about 5,000 in 1A, 1B, right? It's 1A and 1B.
1A.
The
1A.
1A. Okay, so 1B in the county, just on first responders, you could call that just a little short of 1,500, I think. So I think we're right. I think when you get 1A through 1C, you're talking about 15 to 20,000 people out of 160,000, probably.
Okay.
All I know is that we have approximately, if we figure half of the people are going to be immediately available to vaccinate or willing to vaccinate, hopefully it'll be a little bit more than that, but still, we have to get a few thousand vaccines off the ground into people's arms in the next several weeks to move through the 1A in order to kind of open this up to the 1B. So that's kind of our game plan, if you will, to try and move several thousand vaccines through over the next few weeks.
Thank you. We do have some other questions too, and I was going to try to wait until we paused after 4, but I'll ask one right now, and Justin, you can help with this one. We've had people inquiring about how they can volunteer with our response. What's the process for that?
Sure. So there's a couple different ways, but they can go to the myvolunteerregistry.org, and it's a Michigan website, and they can put in all their information. And in the notes, if they only want to solely volunteer in St. Clair County, they can put in the notes, I'm only interested in volunteering in St. Clair County. If they're interested in going other places, that's great. But just know that we can definitely use you in St. Clair County. If you also want to send us an email to the COVID-19 email box at covid19@stclaircounty.org, that will let us know, hey, heads up, I put my name in the Michigan registry. Please flag me and let me know when I can help. That would be really great. We will take all of the skilled and unskilled volunteers that we can get our hands on. We can definitely put you to work.
All right, thank you. Doc, has there been any information regarding pregnancy in this new COVID-19 vaccine, especially those people who work in emergency healthcare settings?
So currently, a pregnant individual can receive the vaccine after consideration of what our overall risk is. COVID does cause an increased risk for pregnant women and their unborn babies. So the theoretical risk of an mRNA vaccine, it would be very minimal. There's no direct studies yet, although they are being done and they are hopefully going to be released some information soon. But we do know that there is no known safety concerns with the vaccine currently, and that goes both theoretical as far as the phase 3 trial. There are more studies ongoing, and the overall benefit of the vaccine has to be weighed against the unknown of actual studies and the known risk of the vaccine or the actual infection on that individual. So I would encourage those of you who are pregnant, who are working in high risk environments, to have this conversation with your OBGYN. Those of you who are pregnant and not working in high risk environments, you might want to pause and wait and see a little bit until we get a little bit more under our belt. And if you're thinking about becoming pregnant, this comes up a lot. My advice would be, especially again, if you're in a high risk group of getting infected, to strongly consider vaccine. and potentially delay pregnancy for the 6 to 8 weeks while you're actively being vaccinated. Vaccine impact is once your immune system is generated and you're reacting to the specific antigen is very specific towards that antigen from COVID. So the theoretical risk beyond that active vaccination state would be very low. We know that vaccines generally don't cause difficulty in pregnancy. The ones that we concern ourselves most are the live vaccines. I'm going too long, aren't I, Dan? Sorry. But even live vaccines are only a theoretical risk. So we know that vaccine history is very strong in the safety in pregnancy. So that's reassuring.
Okay, thank you. Barb, can you hear me?
I can hear you.
I just wondered if our special guests were there yet.
Our special guest just arrived.
Okay, so we're going to pause our questions for the time being. And we just wanted to let everybody know that we're very excited to announce that we are going to be doing a live vaccination shot today. Our nursing supervisor, Rebecca Campow, is going to vaccinate one of our very first staff members, our nursing director, Liz King. And we wanted to give our viewers a snapshot of the vaccine process. And then we're going to then transition back to finishing up our questions that have come through. So here is Rebecca and Liz. Take it away.
All right, so I did draw up the vaccine from our multi-dose vial. Now we will go into the deltoid muscle. And that is it.
Rebecca, can you talk, because this is a common question that we get, you and Liz, maybe both, might want to comment on this. Is it common for our nurses to wear gloves when they're administering the vaccine? That's something we hear about sometimes when people notice that. Do you want to comment on that?
So the gloves are really to protect me as the vaccinator. So if I were to have like open sores or cuts on my hand and we're worried about being infected from the person I'm vaccinated, then yes, I would want to, wear gloves. Mm-hmm. Otherwise, since there is no blood, as we see, nothing, there is no potential risk for bloodborne pathogens or transmission of disease that way. So gloves are not indicated.
Thank you. So how long after someone gets the vaccine do they have to sit and stay put?
So it is recommended to monitor the person being immunized for 15 minutes post-vaccine.
Okay. Liz, how do you feel?
Great. Easy. It was easier than like a regular flu vaccine. Piece of cake. Awesome.
Great.
She did a great job.
Well, we really thank you too for going live with us today and doing the vaccine. Is there any other comments you want to say? If not, we'll transition back to our normal questions.
No, I don't have any further comments.
Okay, thanks a lot for doing
Thanks,
that.
Liz.
Well, you
You're
guys did a
welcome.
great job. Thank you so much.
Okay, we've got several more questions. Doc or Justin, did you have any comments you wanted to say about the vaccination process before we move on?
Well, first of all, as you saw, it's very easy and it takes just a few minutes to get through the process. And when it's time for the general public, when we make the announcement that we're ready to do the general public or group 2, we will have the ability to move pretty quickly should you be interested in getting that vaccine. So please know that we will let you know when it's readily available for you. And we are working hard to get through the group 1 people.
Okay. And more information will be explained to patients when they get vaccinated as well.
I was going to say,
Okay.
the longest time it's going to take, we're going to make sure that every person understands and their questions are answered before they're vaccinated. And of course, there's going to be a post-vaccination observation period for everyone. So they're going to spend more time, being talked to and hanging out, having us tell you about VSafe and the My COVID Alert app and some of these great tools that are available now to help people learn and manage their exposure risks. So,
all right, thank you. All right, we've got several more questions, so I'm going to start asking some different types of questions now that we normally answer each week. Justin, why is it okay for food courts in the mall to be open? People aren't taking food to go. They're crowding around trash cans to eat. Any thoughts on that?
Yeah, so really food courts are takeaway areas. They definitely shouldn't be crowding around anything. To do the right thing would be to take your food from the food court and depart the food court and eat it either at home or in your car. But you definitely shouldn't be grouping up anywhere.
Okay. Another question for you, Justin. We know that the holidays can be a tough time for people, especially during this COVID timeframe. Can you talk about the mental health services that we have available in the county?
Absolutely. So locally, we have the St. Clair County Community Mental Health Support Line, and you can call them at 810-985-8900, or you can actually text them too, which is really cool. And that's 810-956-6335. You can always reach them at email as well at COVID-19 support at scccmh.org. Again, that's COVID-19 support at scccmh.org. The state also has, mental health support, and it's called Stay Well, and that website is michigan.gov/staywell.
All right, thank you. All right, the next question is about our data. Where in the data reports would we find the age of those passing away?
probably won't. Do we have that posted at all?
No.
Age range?
The average age range is 78.
Average age range is 78, and
But we don't have it posted.
but we don't have it posted on our website. But the minimum age to the maximum age is, do you remember what that is? 30 to over 100. So you can see there's all age ranges that are involved. Do we have the deaths based on age brackets? No. Okay.
And I don't expect that we will ever post, someone age 88 died today, someone age 74 died yesterday. I don't think that, because that hits a little too close to home, right? So we're going to respect people's privacy a little bit and produce, have available those ranges should you ask, but we won't do individual.
Yeah. Well, as our deaths unfortunately accumulate, as we get more and more, we probably, in fact, I've looked at our data. We do have that information put together as far as the percentage of deaths in this age group versus that group.
Right.
Because we want to compare it to other communities and make sure that we're not outliers. And we're not. We're very similar to what the rest of the state is showing. But we can have that information available at some point in the future. Probably when things slow down a little bit, because it'll make a little bit more sense. As a real-time data piece, that's not really useful because data information comes into us at all different times in the game here. So sometimes it's very delayed in getting to us. So, but as a piece of information, we are in fact experiencing death rates in the same proportional age groups as the rest of the state is seeing.
Sorry about that. Okay.
That wasn't me.
It's a live show, so there's always something happening.
Yes. Okay. Someone wants to know, is there a place to get a COVID test without going to the hospital?
Sure, absolutely. So in our community, you can go to places like Walgreens on 10th Street in Port Huron. You can go to Med Express in Fort Gratiot, right on 24th Avenue. You can also
do us. Health department.
You can go to the health department. Now, that testing is suspended right now. We will restart on January 5th, and there will be more details very soon on how that's all going to go and where that site's going to be. But The best way to find testing sites, if you're interested, is to go on the COVID-19 resource page at the state of Michigan on the MDHHS COVID site, and they have a test finder, and you can also find it on the St. Clair County Health Department site, they have a link to it. That is the very best way to find a testing site near you.
Thank you. Okay, next question. How long is a COVID patient contagious?
So that would be 10 days from the onset of their symptoms. There are a small subset of individuals who are immunocompromised or cancer patients that may remain infectious for twice that long, maybe 20 days. But the vast majority of us that have been infected, it's 10 days. And even though, and I got to say this, a lot of people misunderstand this because you may still feel pretty crummy at week 2 or week 3. That's no longer the active proliferation and shedding of the virus. That's the post-inflammatory crap that this virus does to our bodies. So you are no longer infectious 10 days post the onset of your symptoms. Now, we also want to make sure that your fevers are gone and your symptoms are better to make sure that you're not one of those outliers. But if you meet all those criteria, you are, in fact, you should be confident that you're no longer contagious. And you don't need a repeat test to tell you that.
All right. Here's another data question. Over the last several weeks, significantly higher amounts of new deaths and hospitalizations are reported on Tuesdays and Wednesdays. Can you talk about what causes this? Do the 3 hospitals only report out once a week or something else simple like that?
It's reporting.
Stand by. We're getting that answer.
I'm sorry. He's trying to. So it's not that the hospitals only report at certain times. It's that information gets fed into the MDHHS system, and then that system gets sent back down to us. And so sometimes that system breaks down a little bit. It's delayed a little bit, and that's why I've said over and over again that weekly summaries are quite a bit more. Better interpreted than the day-to-day variations. If you notice, even our day-to-day variations will go from having 50 cases reported, and then the next day we'll have 97 cases reported. And a lot of that is just reporting variation, the way the data gets put into a system and the way it's taken out. If that makes any sense.
Okay. Next question. Should someone that was exposed to COVID just wait for symptoms, or should they go get tested? And if so, how long after exposure should they get tested?
So that's a great question, and I appreciate you asking because it's a source of a lot of confusion, myself included. There's no question if you're symptomatic, you should get tested. If you've been exposed and you run off and get a test the next day, it's not likely to be helpful. But say you've been exposed and 3 to 5 days, maybe 5 to 7 days is kind of the sweet spot there. That you're wondering if maybe you're an asymptomatic shedder or infected, and you just want to be sure. That would be when your testing should be kind of focused in on. Now, if you get a negative test, it doesn't mean that you can throw away your quarantine status. You still need to quarantine for the duration of time that we advise. And we're still advising 14 days for the majority of people, right? Because we know that close to 100% of the people will be captured in that 14 days. If you want to reduce your quarantine period to 10 days, you do need to remain asymptomatic and monitor yourself for the remainder 4 days. And it's kind of nice if you can get a test in there as well on that day 3, 5, 7. I like to use like day 5 that's day 5 post exposure, the last day of your exposure, because if you do get a test that day and it's negative and you remain asymptomatic, it's more reassuring than if you get the test on the first day.
Okay.
So you can get tested if you're asymptomatic. If you're asymptomatic, it does give you some cushion and some reassurance, but just remember to not let your guard down till your complete quarantine period is over.
The next person asked, I know the antibody test should not be solely used to detect COVID, but how quick would it pick up an active infection?
Well, that's
It
why we
doesn't do
don't
it.
recommend it be used. Well, we don't know. We don't know how quickly people will mount an antibody. Some people may mount an antibody response very quickly and others not for weeks. We just don't have the information we need to tell you. If you think you're going to use an antibody test, do it at this point or this point in your infection. So that's why we're recommending not being used to diagnose your case. If you get a positive antibody test, all we can tell you is that you have had a previous infection, period. It doesn't tell us whether you're still infectious. It doesn't tell us whether you're protected with that antibody. And so it really doesn't guide you in any real clinical way. So antibody tests are going to be useful, I think, in the future, but they still have a real limitation right now as far as I would still opt for a rapid antigen test or one of the molecular tests to decide whether or not you're infected or not.
All right. This next person is asking you, Dr. Mercatante, what, if any, supplements should we be taking at this time? And do you feel they are beneficial in preventing this virus, such as vitamin D, zinc, etc.?
I don't know. I know that it's just not enough information out there. So I've always said that it's always important to make sure that when you're ill, that you get plenty of liquids, that you get your rest, and if you feel like your diet is somehow negligent, a multivitamin of some kind. Should you take zinc? Should you take vitamin C? Should you take vitamin D? It's just not clear in the literature at all right now to recommend any one of those vitamins or at what dosage to take. So my suggestion is to just eat well. If you think you have a deficiency in your diet, to take a multivitamin and pay attention to fluid intake and some of the other things that are important for your health, plenty of rest, etc.
Okay. How many active cases in St. Clair County today?
Oh, I just did that number, although Brandon and I tend to disagree. If you just take the total number and you subtract the recovered and the deaths, we're about 3,200. But what did you say your estimate pulling the data from?
The update has 97 new cases today.
As we catch up on cases.
Okay, and Brandon says as we catch up on cases, he's estimating it's more like 1,500 or 1,600 active cases that we know about. So do remember that most of the current literature would suggest that for every case we know, there's anywhere from 3 to 7 cases that were undetected. So you do that math and you can kind of get an estimate as well.
Okay. Is there a timeline for when our local CVS and Walgreens will have the vaccine available?
Soon.
It's a very good answer.
Now, when they do get the vaccine, it will not be for the general public initially. When
Right.
our local Walgreens and CVS gets their vaccine, it will be they will receive a vaccine to provide to our nursing homes. That's going to be their gig for the next few weeks. So, when we will see vaccine in our pharmacies that are available for the general public, believe me, we'll let you know as soon as that is the case.
Yeah,
But
and
I do
a
believe they're
little bit
getting a vaccine in this next couple weeks.
Yeah, and a little bit more on that. Obviously, we are kind of stuck in a logistical chain right now. So they got the EUA. They had, a few million, something like 20 million already made, but they have ramped up production to the highest level right now. And as that production continues to catch up to the need over the nation, we will start seeing more and more availability. And so we're just in that lull right now where everybody's being rationed off a small portion, but you will continue to see a higher amount in the coming months. So just be a little patient and everything will work out, I promise.
The logistics of this vaccine rollout are absolutely mind-boggling, and I'm not a logistics person, and I can send those of you who maybe understand logistics can fully comprehend what is going on both at the national and at the state level. It's profound. So we're happy to get our allocations. Yeah, and the fact that we all have our allocations reasonably close to the time we were told we have them. We are actively vaccinating those at highest risk, I think, is a success story in itself. So
and the fact that we're doing it before January 1st, 2021 is an amazing feat.
Okay. The next two questions are pretty specific to medical conditions. My 18-year-old is type 1 diabetic since he was 2. Would the vaccines be safe for him? And would that be group 1C?
Yes.
Yes.
Yes and
Okay.
yes. So there are no, let me be very clear, there are no contraindications to the vaccine based on medical conditions other than a history of anaphylactic reactions to the vaccine or its components. Okay. So
Okay.
if you have, and then the only other added precaution is if you've had a previous history of, I'm out of it again.
Oh,
No,
go
And
you're
ahead.
so if you've had a precaution of having a previous history of anaphylaxis to a different form of an injectable drug or vaccine component, that would be a precaution, which means that you can still receive the vaccine with added monitoring. So there is, at this time, no medical conditions that are contraindications to the vaccine.
Okay. All right. Someone asked us
All
another
the ones,
question
yeah.
specific
Now,
to that, but you just answered that.
The age.
I
So
can-
this one is
yeah.
asking about 14. So the Pfizer
Yeah.
vaccine is 16 and older, and the Moderna is 18 and older. So right now, we do not have any vaccine for anyone under the age of 16.
Right.
That may change. But vaccines that are generally approved for children have different levels that they go through as far as trials and things like that. So we're going to see those, I think, but it's going to be a little bit further down the line.
Okay. Thank you. Speaking of those allergic reactions, somebody asked if someone with allergies, should they get the vaccine at the hospital? What's that process going to be?
I can speak to that if you want to take a break. So no, that's not required. Like anywhere you take it, whether it's the health department, the hospitals, later on down the line at doctor's offices, everybody will be able to respond to that immediate reactionary situation. And then should it continue to decline, EMS can be called and you could be taken priority 1 to a hospital facility for further treatment.
Any vaccine provider needs to have the ability and the knowledge to respond to anaphylactic or allergic reaction. That is a basic requirement. So.
Okay. Someone wants to know, how long will it take for the vaccine to be effective once you receive it?
Well, we consider 2 doses, and it would be 10 days after the second dose. So I'm just telling people 2 weeks after the second dose, and I might be proven wrong. We may go with 7 days after the second dose, but we're not going to consider the first dose protective. The literature is out there. There's a small percentage of people who have antibodies, and it's just not something we're going to rely on. So it would be after the second dose. So assume you're going to need 6 weeks to be protected with this vaccine. 6 weeks because you have to go through the first dose and the second dose 3 to 4 weeks later, and then you have to wait another week at a minimum before you have that protection built up.
Okay. How many people do we know yet have been COVID vaccinated so far? Do we know in St. Clair County?
In our county?
Yeah.
I don't know. Sorry.
The number as far as I know right now is probably less than 200 right now.
Oh, I was
In the
going to
county.
say more than 200, less than 500, but.
Okay, that's fair. You're the doctor. You're smarter than me.
I'm just guessing.
So someone asked, is there a database that keeps track of what vaccine a person gets in case they forget when they get the second injection or future ones if needed?
Yes.
Yeah, so every time you get vaccinated, it's required by law for this one, it will go into the Michigan, I always forget what, MICR, Michigan Community Immunization Registry. So your vaccine will be in there under your name. Now, we're also going to be giving you a card and something to keep on hand physically. So hopefully there'll be multiple ways for you to remember which vaccine you received.
And we're going high tech too, right, Doc? We're doing an app as well, correct? There's going to be an app available. Didn't I hear that? Isn't there a vaccine app coming out?
Yes,
No.
I believe so. Kristen.
Yeah. I heard there was. So.
More
Okay.
information
Okay.
to come on that.
Yeah. we're going
Okay.
we're going iPhone-ish.
We've got two more questions. This person, this week's total less deaths, hospitalizations, and recovered leaves 3,000 plus people out there somewhere. How do we know when these people have recovered? Or is there an assumed time frame they should be put in the recovered data if they have not been hospitalized or passed away?
So I'll take this one because we've said it a lot. Right now, we're still fairly overwhelmed, and then I'll let Brandon speak because I know he's got some more information. But we're still fairly overwhelmed, and I say we, I mean the health department. Their staff is just going 100 miles a minute, and they're as they work through cases, that's how they pull them off and put them in the recovered category. And there's just not enough hours in the day right now to manage and work through all those cases to put them in the recovered category. There's a potential that far more people are in the recovered category than we show right now in our data. And it's literally just time spent on those cases to close them and move them. Brandon, do you have any more? Did I miss anything?
So Brandon did say that, the state uses a 30-day, if you're not, if you haven't had a death reported in 30 days after a COVID, they consider you recovered. So they do use that process. I think Brandon has a way of extracting data from our system and doing the recovered. As I mentioned earlier, if you just do the math, it's 3,000, but he's telling me that if he does his best estimates, it's closer to under 2,000. So you can see that we're off a little bit as far as pulling people out of the system, putting them into the recovered category. So we'll get there. As Justin said, I think what's important to realize, again, that say you just round this off to 2,000 active cases, that's 6,000 cases active minimum out there. And that's still a sizable portion of the community that could be transmitting the infection. So we're not down to a pittance yet at this point. Even though we haven't caught up with pulling them all out, there's still a lot of people out there with active infection.
Okay. I just want to let everybody know we're going to be ending soon, but I'm trying to get through these last couple questions. What metrics are you looking at to determine when it is safe for schools to reopen?
Oh, I think our schools are all planning on reopening after January with the rates coming down. Many of them had grade schools open during this time and have been doing relatively well, knock on wood. Not to say they don't have cases, but they're managing them pretty well. So there have not been any widespread outbreaks in our schools. And after now that the emergency restrictions have been lifted for high schools, I think they are all planning, without exception, to bring the high schools back as well, based on their boards, their individual board decisions, et cetera, et cetera. So we talk regularly. We go over the data with them, and we prioritize school-age children as one of our investigative cases so that we know that. When we start having problems in the schools, we talk to those superintendents, we talk to those buildings, and we come up with plans. So I believe the schools are going to be continuing to do their best.
Okay. Lastly, two more, and then we're ending. Are people required to tell you they have COVID? I've been exposed twice by people I know, and that's had it.
So if an employer who is aware of a COVID case in their employee system is required to tell their employees that there has been COVID within their employee. They're not required to say who, but they are required to notify that there have been cases. Same with the schools. So certain businesses, jurisdictions are required by law to tell. Now, are you required by law to tell somebody you have COVID? No, you're not. Is it the right thing to do? Yeah. Now, we have something now called the My COVID Alert app. One of the apps that's not the one you're talking about. I want to push that because it's a way you can download this app and you can push out anonymously to people who've been near you if you have COVID. They can, in other words, they can be notified of their potential exposure without you really having to out yourself or to reveal your personal medical history. It also provides day-to-day guidance on your exposure, on your symptoms. So it's My COVID Alert. So go look it up, Google it, and download it, because that's a really worthwhile app to have, and I think it will help people out a lot. Whether or not we get to you and you have a professional guidance through this or not, it will give you a lot of tools to help notify people.
Yeah, and I'll answer her because I can see the question on the screen.
Okay,
If she
thanks.
tested seven days ago, but she does have chills and she has other symptoms, she should definitely get a second test, because the first test 7 days ago could have been too early. You know, she could have reacted after noticing that she was exposed, and if she's showing symptoms, she should be tested again.
Thank you.
Remember,
Thank you, Justin.
remember the test. Yeah, remember the tests that we use only detect the virus in a very narrow window. Okay, and so if you're not producing that virus in a certain amount, it's going to miss it. So it's always worthwhile, if you have a negative test and you continue to be suspicious or having symptoms, to go ahead and get another test. It's always fine to do that.
All right. I wanted to remind people too that we go back and timestamp this video and we put it on the Health Department YouTube channel. So if there's any specific questions, you can go and you can find them very easily without having to rewatch the whole video. So watch for that. And we are finished now. So Doc and Justin, closing comments.
Oh, I don't know. I'm frozen again. I just want to tell everybody happy holidays, happy New Year. This is a weird holiday season, but doesn't mean we can't feel love and gratitude for the people around us. So reach out, call those people that you miss, do some FaceTime, and enjoy your holidays. God bless you all.
And I'll echo that. Merry Christmas and Happy New Year to everybody out there. This is a wonderful community that we live in. Everybody works together to get the job done, and I appreciate each and every one of you. We appreciate answering all these questions. I thank you all for putting them in, and the more informative our community is, the better we all respond together. So have a great week, and we'll see you after Christmas and before the new year, and have a great night.
Thank you, Justin. Thank you, Doc.